Okay, good morning, everyone. Welcome to our virtual Walk with the Future Doc. My name's Lauren. I'm a third-year medical student at WVU. So just going to give everyone a quick overview of what to expect as we walk together for the next hour. So today we're going to be hearing from Dr. Davisson about the topic of weight bias. And then as we walk together virtually, she'll be able to answer any questions that anyone might have. Everyone should have just received a little pop-up notification just to consent to the audio recording of the walk. And only the audio portion will be made available publicly on our YouTube channel, which is WVU Walk with the Future Doc. And then also just wanted to mention our Facebook page is the same name, WVU Walk with the Future Doc, and it'll be the best place to look for updates about future walks that we'll be hosting. So thank you everyone for joining us today. Now I'd like to introduce everyone to Dr. Davisson, who is an internal medicine physician certified in obesity medicine in Morgantown, and she's currently working at the Medical Weight Management Clinic at WVU Medicine. So I will let her begin her talk on weight bias.
All right. Well, thank you very much. It's great to be here. I am not walking, but I put the cloud background so it will have that feel as if I'm walking. But the reason I'm not walking is because I really want to start today's talk by reading you a story. And so I have to be able to read. So when I read this story, I want everyone to really try to visualize yourselves being the main character of the story. And then we'll talk about it in a little bit. You are a 28-year-old single mom of 2 elementary school aged kids. You have obesity as you are only 5'3" tall and weigh 250 pounds. You work at a fast food restaurant earning the federal minimum wage. The nature of your work involves varying shifts, so you sometimes have to leave your kids alone when you work. You utilize SNAP benefits, the Supplemental Nutrition Assistance Program, formerly known as food stamps. You are thankful you get free meals while you are working because this reduces the amount of food you need to buy. Although you know it may be detrimental to your weight, you cannot afford to pass up those free meals. You live in a small rural town without a grocery store, so you mostly shop at one of those dollar stores that sells some shelf-stable food. Approximately every 2 to 3 weeks, you have enough money saved to pay for gas so you can drive to a full-service grocery store outside of your town. Today is one of those days. So you drop the kids off with their dad and drive to the store. You walk through the fresh fruit and vegetable area thinking that you should buy those foods for your health, but the prices are high and they do not stay fresh for long. You remember how you splurged on strawberries last time you shopped here, but were busy working long shifts for a few days. When you finally pulled them out of the refrigerator to give them to the kids, they were covered in green fuzzy mold. You pass on the berries, but you do buy a few apples. You aren't sure the kids will eat many of them if you are not there to cut them the way they like, but you take the chance because apples typically last over a week. Then you load up on foods and meals the kids can prepare for themselves when you are at work. You pick up some Lunchables and frozen meals. You select several boxes of macaroni and cheese and hamburger helper to make for dinners. You choose a few boxes of frosted cornflakes and Pop-Tarts for the kids to have for breakfast, and you use the rest of your budget to stock up with snacks for the kids, like animal crackers and pudding. You get in line to pay for your food items, behind 2 well-dressed women. One of them looks at the items in your cart, then looks your body up and down. She leans over to say something to her shopping partner, who then looks at you and shakes her head. You look at the items in your cart, and you are ashamed to realize that except for the apples, ground beef, and milk, the items are mostly highly processed carb-heavy foods. You have experienced similar stares in the past, and suspect you know what is behind the women's disappointed looks. You think they probably disapprove of your purchases and believe that the items are evidence that your choices are to blame for your excess weight. So I suspect some of you may have known situations like what is described in the story, or even personally experienced something in yourself or a loved one. And that story really describes a classic case of weight bias because the women seem to be blaming the main character for her excess weight despite not knowing the full picture of her life and what went into her food choices. So what is weight bias? So it's basically negative attitudes and stereotypes about people who have obesity. Now, many of you may have heard the term implicit bias. So implicit bias means bias that's automatic and not done consciously. And it can affect many groups. So you can find out if you have implicit bias to things like race, gender, obesity, or other related topics by taking what's called the Harvard Implicit Associations Test. And so I would encourage all of you who may be interested to just Google Harvard Implicit Bias or Harvard IAT, and you can find the link, and it's free for you to take as many of these as you want to find out if you have implicit bias to anything. But one of the options is to find out if you have implicit bias related to weight. So why does implicit weight bias occur? Well, a lot of times this is something that can be generated just from your environment. Media images can play a really big role. We've noticed that in the media, when there are photos, when there's a story about weight, they tend to include photos that actually are unflattering. They may show the person headless, which makes people think they would never want their head associated with their body. They wouldn't want anyone to know who they are. They may show them eating unhealthy foods. They may show them with clothing, kind of buttons popping, that kind of thing. And it just really reinforces negative stereotypes. A lot of characters in shows are portrayed as not having friends until they lose weight. There was Fat Monica on Friends. A lot of times they're the villain in the story, like Dudley and Harry Potter. So there's a lot of reasons why these stereotypes can get reinforced. So why should we care about weight bias? Well, the reason is because these negative stereotypes can impact people's education in school. Children may be not identified as gifted. People's self-esteem, it can lead to depression. It can affect employment. There have been studies showing that people may be less likely to get hired or interviews or promotions based on their weight. And it can even happen in healthcare. And so this is really where I want to focus, because a lot of us here are in healthcare, and you would think that would be a safe place for people. But unfortunately, people with obesity have been shown to get less preventive healthcare services and delay medical care. And the delaying medical care may be because they have perceived biases in the past that makes them really uncomfortable going and seeking medical care. And so it leads to this paradox where the people who may need the most health care because of comorbidities related to their obesity are actually getting less health care because they don't want to go in. And this can lead to worse health outcomes. And I think a really, really recent and timely example of weight bias is COVID vaccinations. So as you may know, COVID affects people with obesity in much more severe ways. They are more likely to be admitted to the hospital, on a ventilator in the ICU, and even to die. So they're very high risk. So you would think they would be prioritized for the COVID vaccinations, but in some states like Ohio, they've recently said they are not putting them on the list of high priority. And it's thought that it's because it's considered their choice to have obesity. It's their lifestyle, so why should they be provided this benefit of getting the vaccine? So that's a really good example of bias and stigma where the person's being blamed for their condition, even though they are the ones who really need to be protected the most. So there's a lot of things that we can do about this in healthcare. And, one thing that we do and we talk about with the medical students is training people to use language that can be really helpful, like first person language. So instead of saying that someone is an obese person, we would say they have obesity or have excess weight. We try not to say, we try not to label them with their disease. We don't want to say that they are obese. We want to say they have obesity. And we do that with a lot of other diseases, but with obesity, we want to try to do that as well. And in healthcare, another thing to make people feel more comfortable is making sure that we have appropriate furniture that fits them, equipment, gowns, right from the very beginning of their encounter with the healthcare system. If they have things that make them feel comfortable, they're going to be more likely to continue to seek care. So that's really, really important. And patients should really ask for those things as well. We have to really speak up. So what do you do if you have bias? Okay, so if you take the implicit associations test and you find out that you have bias, that's really the first step. Being aware of it is the first thing. And then when you go through your life, kind of look for examples of it in yourself. If you notice yourself having a reaction like that, you can do something about it once you've identified it. You can also recognize it in others. And then therefore it may be time to start speaking up. I know a lot of times we're uncomfortable doing so, but this is how change happens. So if you hear someone saying something that is showing bias, really stepping up and making a comment can be helpful. The other thing you can do is put yourself in the perspective of the person with obesity. And that's why I read the story, and I hope that you could all kind of put yourself in there and really feel like what it was like to be that person and be in that situation. And if we put ourselves in the person's situation, it can help us then reduce our own bias. You can also think about, if you notice it happening in yourself, replace that bias with an example that proves that bias is not always true. So instead of generalizing and saying everyone who has obesity is a certain way, think about an example of someone who proves that that's not true, and really try to focus on that. Now, one thing we haven't talked about is that people with obesity have the same bias actually towards themselves sometimes, and they blame themselves. And this is really problematic. And one thing is that people will say that they're going to change their attitude towards themselves once they lose weight. They'll say, I'm going to change and then I can love myself. And we really don't recommend that you wait. We really recommend you trying to have a positive feeling about your body before you lose weight, because that will help you with your self-esteem and make it actually probably easier to lose weight. I mean, if you keep waiting, bodies are not perfect. So what happens if you keep trying to wait to love your body till this next milestone or till you lose the next certain amount of pounds, then there will be something else wrong with your body. So it's really better to just accept your body the way it is before you try to lose weight. And I think recognizing how complicated the problem of obesity is helpful for people and for healthcare workers to really recognize that, because when you think about the complexity of obesity and how it's affected by so many different things, and it really is a disease, that can make it easier to not have so much bias. So if you have bias towards yourself, the things you can do are notice if you're doing negative self-talk, make it a habit to try to replace that with positive thoughts. And the other thing that's helpful is to really focus on outcomes other than weight loss. Think about things like what you can do. There are these non-scale victories that we always talk about. Can you play with your grandkids? Can you go for a walk without feeling short of breath? Focus on some of those, outcomes other than just weight, and that can be really helpful as well. So let's go back to that story, that scenario I put you in at the very beginning. And again, I want you to visualize yourself. You're that woman, you've got that grocery cart, and you're being judged for what's in it. So which of the following actions do you think would be most helpful for getting you to change your eating habits and food shopping habits? A, shaming you about your weight, like these two women are doing. B, having the medical students set up an information table at the store to teach about ultra-processed foods. Or C, policy changes that make healthy food less expensive and more convenient. Obviously, I would argue that C is the right answer, policy changes. And I think the story really describes how social inequities can make it challenging for people to eat healthy foods. So there's a lot of talk these days about social determinants of health, and it's increasingly being recognized that these are maybe even more important for health than these individual things that we do for people's health. So going to those other answer choices, shaming does not work. Okay, so what those women are doing, which is expressing kind of explicit bias, definitely doesn't work. The studies have shown that sometimes in the past, parents would try to use shaming to motivate their children to lose weight. Studies have shown that people who have more shaming actually gain more weight. And we suspect that's because of damaging self-esteem, leading to depression. And then what do people do? They go to food for comfort. So shaming definitely doesn't work. And there have been a lot of people saying, oh, that we need to bring shaming back. And we definitely don't. That's not going to be useful at all for helping people lose weight. So what about that second answer choice, that teaching about ultra-processed foods? Well, if you notice in the example that I gave, that patient seemed to already recognize it. And see, I think that's an implicit bias, is us assuming that she doesn't have that education or that knowledge about the foods and what they may do to her. So the explicit bias was when they were shaming her in the store. The implicit bias was just assuming that she maybe doesn't know, when she very well could. People who have excess weight don't necessarily not know better ways to eat. They're just maybe having more trouble implementing it. So while education is not a bad idea, and it's certainly not going to be harmful, it's just not necessarily getting at really the root causes. And you're going to have much more likely of a chance of helping someone if you focus on some of these bigger social determinants of health. So those are my thoughts on weight bias. We do teach a similar kind of curriculum to our medical students at WVU, because we're trying to really help instill from early on in their careers how to talk about weight in ways that are non-offensive to patients, that can really lead to helping them the most. And so we are doing things like that at WVU, and we are hoping to see some good results from that. So very curious what everyone's thoughts are, if they've had any similar experiences or have questions about what I talked about.
Great. Thank you so much, Dr. Davisson. I really love that. And I love the story you told today. Really put things into a good perspective. So if anybody has any questions or comments that they would like to bring up, you are more than welcome to unmute yourself and ask aloud, or you can go ahead and type in the chat your question. You can either send it to me. My name is Mia, and I am a second-year medical student at WVU, or you can send it to everybody, and I will make sure that your question gets answered.
This is Rosie, Dr. Davisson.
Yeah, hi.
Hi, and you made the point of making healthier foods more available on food assistance programs like SNAP. I wonder, like we do have in West Virginia, the 2-for-1 fruits and vegetables at the farmer's market with SNAP dollars. Wonder if there's a way we could capture whether or not that incentive to buy the healthier food at the farmer's market instead of at the grocery store, if there's a way we can tell, or do you know if indeed that incentive program.
Okay, she got cut off there at the end, but basically I think that's a great idea to try to measure some of these things we're doing and see if they have impact. You know, we all know that people can come up with lots of great ideas for what seems like it would help people, but if you don't measure outcomes and see if it made a difference, you don't really know. And so that's really, really important. And I certainly hope we can start doing some analysis and figuring out what works.
SNAP education, the extension service actually does follow those numbers. And sorry, I'm out of breath. They do research on that. Kristen McCartney is the registered dietitian in charge of SNAP Ed. Gina Wood also looks at the family nutrition program. So they would be good resources for you if you want that information.
Could you type in the chat her name and how to get a hold of her, since I'm out walking and I can't take notes?
Rosie, we can also send it to you after the program. Send you an email.
Thank you, because one of our third-year students is doing a little poster on medical students' attitudes towards SNAP. And so that just might be one more little tidbit that would be helpful to know to justify more incentives for healthier foods.
So Krista McCartney, she's the dietitian that does our nutrition immersion with us out at Eastern. So you might meet her at some point too.
Did Mitch, were you trying to ask a question? I saw. your hand.
Yes, I wanted to ask a question about kind of like the reverse of what you said. I know this thing can go both ways, and I've always been a very thin person. I've always been trying to gain weight and not been unsuccessful at that. Even as I grow in age, you think I just put on weight naturally, but I wonder if there's a way that you would suggest that that a person can gain weight. If there's certain foods that I might look to eat, or whatever, healthy foods to put on weight as opposed to losing weight.
Right, right. Well, we need to study you first of all, because not so many people have that problem, and we need to figure out what's different about your body that does that. But we would definitely agree with what you said about if you're going to be increasing your calories, make sure they're healthy foods. The thing I hate is when people say, oh, well, they need to lose weight, so let's just pump them full of ice cream all day long. I mean, that's not good either. We want to just make sure you get more of the healthy foods. So, don't be afraid of having some fat in your diet. Fat has a lot of calories, as long as it's the healthy types of fat. So I would focus on, of course, keeping your vegetables in, but maybe adding some fat to them to make them taste delicious. We like olive oil, and that can add some extra calories, but make sure you're getting adequate protein, and just make sure you're not just going to the processed junk foods, because you probably would gain weight if you added all processed junk foods, but it's not going to be healthy for you, and we wouldn't want that.
Would you put avocados on that list?
Yes, absolutely.
Okay.
My dietitian Kathy's giving you the thumbs up.
Okay. Thanks.
What else,
He,
Kathy?
he brings up a good point about thin shaming, because that does exist as well.
Yeah.
I think in answer to Mitch's question, an easy way to hide fat in avocados is in smoothies. So he could easily get an extra 200 milligrams of healthy fat by just sticking it in a smoothie, and he wouldn't taste it as much. Just make it a little creamier. So that might be one idea.
Healthy fats are great because you don't need a volume, right? They're so concentrated in calories. A teaspoon of fat has 5 grams of, a teaspoon of like olive oil has 5 grams of fat, which is 45 calories. So it's an easy way to just kind of, put a little olive oil in your scrambled eggs, or like add some avocado to your salad.
What about nuts, Kathy? Would you recommend nuts as well?
Absolutely. Nuts and nut butters, both. They're like the best of both worlds. They got fat and protein.
Hey, Dr. Davisson. Oh, sorry, go ahead.
That's okay. I was just gonna say he made such a good point that fat shaming is not just with being overweight, but also with being excessively thin too. We just think that people who are thin, they can just eat whatever they want, and they can, not put good healthy foods in their body too, and it's not a problem. But it's definitely on both ends of the spectrum.
When you say that too, I see a lot in clinic where patients were thin as children and they were pushed food, and usually unhealthy food. I always think of the Bridget Jones's Diary, where Renee Zellweger, I think her name is, she drank melted ice cream to gain the weight for the part. But then when you think about the hormones with obesity, that could have lasting, lifelong effects of gaining weight through unhealthy means like that. But then I want to bring up too, you brought this up in my talk last time I talked about how the bias affects the pharmaceutical industry. Mm-hmm. Can you talk a little bit about that?
Yeah. So you may or may not know this, everyone, but when you have health insurance, you have a pharmacy benefits manager that manages all of the medications. And that's where you hear about your formulary and what's covered and what's not covered. Well, there's been basically like a blanket exclusion from virtually every health insurance, that they take the weight loss medication part of the formulary and say that's not covered. We won't cover that. And do you know why? Because they think it's people's own fault.
What was it again? 84444.
Jen, can you mute yourself? But so they actually will not cover weight loss medications. Now, we are doing advocacy to try to improve coverage. But all treatment of obesity used to be the same way. A lot of other things. For example, their medical visits, when they see us in the weight management clinic, we have to be treating their comorbid conditions, which of course we do. We're looking at the whole picture. We're looking at the diabetes, the blood pressure, the sleep apnea. But if we don't, if we code that visit was for obesity or weight management, it's automatically denied by every insurance. There's no treatment coverage just for obesity to see the medical doctor. Now, recently, Medicare has come up with one very specific program where you can do counseling for weight, but of course, it's a little bit complicated to try to implement that in practice. Has a lot of requirements. Most people aren't doing it, and it's only for Medicare. So you'd have to have a program that was only limited to that specific type of patients because the commercial insurances aren't covering it. Bariatric surgery also used to be really difficult to get covered. They've made a lot of rules about the criteria to get bariatric surgery that really don't make a lot of medical sense. It's very clear that they were put in there to hinder people being able to do it because everyone thinks it's their own fault, so they shouldn't be able to access the surgery that has really good outcomes, really good long-term benefits. And there's, if you look at the benefits of surgery medically, if it were on a paper as some other treatment and people didn't know it was bariatric surgery and they looked at how good the outcomes were, they would say, yeah, you should definitely cover that. But because it's bariatric surgery, it's not, and it's purely weight bias. We suspect it's just because they think people don't deserve that surgery. They could just fix this problem on their own, not understanding how complex obesity is. So really good point, Tria.
Dr. Davisson, you talked about how there's advocacy going on to include medications on formularies. And earlier you had talked about policy changes regarding food. What sort of advocacy is going on regarding policy changes to make healthy food more affordable?
Well, at the national level, there's advocacy for obesity treatment. It's called the Treat and Reduce Obesity Act, or TROA. And in West Virginia, Senator Capito is a co-sponsor. It's a bipartisan piece of legislation, but they've, I'm learning more about advocacy. This isn't something that I've always been involved in, but this has apparently been years of introducing this legislation, and it just goes through multiple iterations and discussions, and hopefully someday it will pass, which would then allow access to more obesity treatments. In West Virginia, we've just done some advocacy, just talking with our state employee insurance, PEIA, about treatment coverage, and WVU medicine we've talked about, and we've made some improvements in coverage based on having these conversations, which has been great. As far as advocacy for food access, I think that's probably a next step that needs to happen. And I don't know, someone else on here may have more information about what is going on right now. But as far as I know, that would be probably the next thing we need to tackle.
I think we're working on that from like you said, kind of a social determinants of health arena. SNAP is always on the chopping block for some crazy reason. And of course, the registered dietitian, think people like extension services. And of course, all our medical professionals around the state are kind of making sure we advocate for keeping those dollars available and not reducing them. Fortunately, during the pandemic, they have increased fairly dramatically. which I know has been a benefit for our patients, Laura, for sure. The other thing they're doing is, if you look through the state legislation bills, they're advocating for things like crop block grants, to increase our agriculture infrastructure, to kind of help us increase growing produce for ourselves and being able to get it out to our people here in the state. And they're really interesting bills. They're very innovative. So I encourage anybody to, go on the state legislative website and just, filter for food and nutrition, and you'll see what's going on, as far as bills in the legislature.
Yeah, I know there's a lot that goes on for improving healthy access to healthy foods, because that's one of the things that changed with getting the 2-for-1 benefits at the farmers market.
Yes.
Yeah, so I know there's stuff going on. It's just every legislation session, you have to kind of keep an eye out for it.
Yeah, and that's hard to do, let me tell you.
And there's, Dr. Davisson, you might know the name of it, but there is a advocacy branch. I can't remember the name.
Wait, an advocacy branch of what? You kind of froze up a little bit there.
The obesity, I might be getting towards Preston County, the Obesity Medicine Association.
Oh, yeah. So I'm on the committee for the Obesity Medicine Association Advocacy Committee. And so, each year the committee decides on their priorities for the year. Last year, things got kind of went a different direction with the committee because of COVID. And we ended up writing a piece about the importance of telemedicine for treating obesity and how to do it appropriately. And we're still working on getting that edited and published. But so that's kind of the direction the committee went in last year, because telemedicine just took over and changed a lot of people's obesity medicine practices. And we definitely feel like that's another thing that we need to advocate for, is making sure we can keep the telemedicine accessible, because that's been super helpful for treating our patients, giving them the frequent follow-up that they need. So that's another thing we need to advocate for. But this year, the advocacy for the committee is going to, I think, take on more coverage of obesity treatments, is going to be our next thing that we're going to work on.
I think that is for dietitians as well. They introduced the Medical Nutrition Therapy Act into the Congress that actually got introduced recently. So we were really excited about that. And that's going to expand coverage for dietitians, because believe it or not, when people are suffering from obesity, they don't pay for the dietitian to see them either.
Right.
Which is crazy. If you guys are in the southern part of the state too, a good resource for you is Dr. Jamie Jeffrey. She's a pediatrician in Charleston and does amazing public health work related to children and families down there. So I would encourage you, if you wanted to learn more about what she's doing, to contact her.
Mitch, were you raising your hand for another question?
Yeah, I was wondering if you could recommend any books, websites, podcasts, or anything like that that might help us to learn about this thing, obesity and weight control and that sort of thing.
Oh my gosh, there's a whole bunch of resources out there.
Some ones that you would highly recommend, some really good ones that you got to read this. If nothing else, read this one. Are there a couple that really stand out?
Oh, Kathy, do you know of a really good one to recommend? Some of the ones I listened to, I don't know. I've been listening to one called Cut Through Nutrition. It's a podcast.
Book-wise,
It might be a good idea to have the med students in the culinary track take that on as a task, because there is so much out there that people have a hard time choosing what to read. And if we could recommend a few things
that
might be,
yeah.
So that might be a good project.
So are you looking for yourselves clinically to learn more, or for your patients to learn more?
I'm looking for something not only for myself, but also to recommend to other people. I mean, I do walks with other people. Sometimes they're of all different sizes. I'm just a person personally have the problem with, I always had a problem with gaining weight, but I have other people, friends and stuff, who have the opposite problem. And so I just like sharing information and that sort of thing to be able to help everyone. So if there's anything that I wasn't sure if there was anything out there that everybody's reading this, you know, you got to read this one, you know, if nothing else. And I just wondered if you come across anything.
Well, if anyone else has any
Like that too.
suggestions, please pipe up. 'Cause
I was going to say, from the medical student side, the Obesity Medicine Association algorithm is, and you can download the PowerPoint for free. It's incredibly thorough. I think Dr. Davisson is the author on it.
it's pretty
But
technical though.
It's
so,
wonderful.
yeah,
It's the med
more
student
for
side.
professionals. Yeah.
Yeah.
I like that kind of stuff too. That's fine. If there's some, I may want to read that myself, and see what I can learn from it. Sometimes there's good things in those kind of things. What was the name of that one?
It's the obesity algorithm from the Obesity Medicine Association. And
Okay.
they do also have a podcast called Obesity, a Disease, which I didn't say at first because it is so technical. They review articles, but I mean, you might like it, so you can check it out.
Thank you.
Mm-hmm.
Dr. Davisson, I've got some questions in the chat for you.
Okay.
So first question is, how important are vitamins, and are they stressed to those who maybe cannot afford them?
So vitamins, you know, if you take a person who doesn't have any major medical problems, who doesn't have a specific malabsorption issue, hasn't had bariatric surgery, isn't pregnant or trying to get pregnant, most of the time people don't need vitamins. And most of the time, probably they won't hurt you, but it definitely seems like a place where people are sinking a lot of money in and not getting much benefit out of it. We think a lot of people are totally overusing vitamins. So you got to be really careful that you have a good reason to take a vitamin, make sure you need it, talk with your doctor. There are definitely, like I said, there are definitely conditions where people do need vitamins, but as far as just taking every healthy person and putting them on vitamins, it seems like it's overdone. And I agree. If you have financial issues, you want to focus on getting the healthy quality foods, not on just, you know, popping vitamins to try to make up for it.
Okay, and then another question. Oh, somebody have something to add to that? Okay, then the other question was, you had mentioned patients advocating for themselves when they go to see a healthcare professional. Do you have suggestions for ways to do this that are productive?
Great question. I mean, I think it's going to depend on what the issue is, but you know, I think if you go to a place that doesn't have equipment that fits you, if you don't have a chair that you can safely sit in, then that's a big problem, and you're going to have to say something and tell them you will not be back unless they are getting that equipment and the appropriate chair that you need. But you know, as far as just talking with your physician, I think you really just need to have an open line of communication. Let them know what you're comfortable talking about and what you're not. So if they bring up your weight at a time when you're not ready to have that conversation, you know, just say it, and then hopefully they're talking to you in a manner that's appropriate and respectful. But I think the biggest thing that I would say is you have to have the proper equipment and gowns, and you definitely need to speak up if they don't have that for you.
I think also if you bring up your weight with a physician and you get an answer that seems biased towards what issues you're having, I would suggest looking at if there's anyone else in the area that might be known for taking care of patients that you would like to check in with. And then also you can look up people's training. I don't know, maybe Melody or Rosie can talk about the culinary medicine training, how to look that up. But for obesity medicine, you can go to the board website and actually just search for who's trained at it in your state.
Yeah, and the other thing is, if you go to a healthcare provider and you have a symptom and they seem to be saying that it's related to your weight, it very well may be, but you also maybe want to make sure that they thought about other things and aren't just blanket blaming everything on weight. You can just ask a very simple question and just say, well, what would you tell, a thinner person about what the symptom could be from? And just that might just kind of non-confrontationally force them to think through it a little bit. You might be surprised at what you might that you might be able to trigger them to actually think a little bit more broadly by just asking that simple question. Like, if it weren't from my weight, what else could it be?
I think Mitch has another question.
Yeah, I was wondering also, is there like a genetic basis to like weight and how we are? Are some people just kind of like naturally thin? Like I'm thinking like that might be the case with myself. Some people may be a little bit bigger than others. And maybe there's a point where we should just say, Mitch, you're not going to gain, as much weight as you really, really want to. Just you're fairly healthy. You're not as big as you would want to be. But you're fairly healthy, be okay with that and just live with it. Is there such a genetic basis that we should just kind of be okay with living with?
Well, first of all, I want to say that there's very, very much a genetic component to weight. We know that a lot of weight and your predisposition to gaining or losing weight comes from genetics. That is undeniable. However, it's the combination of that genetic tendency with our environment that when you put it together has really caused this really rapid increase in the number of people in the United States, especially that have gained excess weight or have obesity. So there's definitely a genetic component. Now, but we don't tell people who have obesity, well, then there's nothing we can do about it. There's still things we can do about it. And I think the same would go for someone trying to gain weight too. You definitely want to focus on the healthy foods, but we also don't want to go for perfection either. We know that there's going to be limits to how much we can do without extreme measures. So let's go for some improvement. And the studies have shown that people can get really, really significant benefits in their health from relatively small amounts of weight loss if they have obesity. So, we're talking a 5 to 10% weight loss will give massive health improvements. And when people have arthritis, especially of their knees, they say that just 10 pounds of weight loss, which on someone who's 300 pounds doesn't seem like a very significant amount of weight loss, can really take 40 pounds of pressure off of their joint and make it so much easier for them to walk and function. And that improves their quality of life. So yeah, we have to work with the limitations that we have genetically and then just do the best we can. But definitely big genetic component. And I think that's a really good point that you brought up.
Thank you.
All right, we are getting close to the end of the hour. The conversation has been really great today. So if anybody has any more things to add or any more questions, ask them aloud, or you can type them in the chat. I'll make sure that they get answered.
It looks like Mr. Healthy has a question. Dr. B, your name is Healthy on your screen.
Oh, that's nice. Thank you. Can you hear me?
Yeah.
Yeah, look, I'm just sitting here thinking about weight bias. It ought to start in the elementary school, preschool. It ought to be part of the curriculum. I mean, the real bias with children occurs with the bullying and cyberbullying and all the other aspects that go with it. And that may be one thing to take a look at, how we can get the school system involved with types of materials that can be presented, ongoing from preschool to high school that really addresses this issue. Another thing that I think is interesting in my work in Africa and so forth, when the school system there had the kids in school, the kids at lunchtime would go over and harvest the fruits, the economic fruits from the trees, which made the farmers angry. And that's a difficulty. So instead of getting angry that way, they went back, how do we resolve the problem? They resolved the problem by providing them with a kind of cream of wheat supplement at the school. And they gave the school a whole bunch of orchard plants. And so they taught the kids how to grow the economic plants. And then the kids could sell the plants, food, to support themselves or to support the schools. I mean, there's a lot of things we need to do with the school system. In Germany, every kid rides their bike to school or walks. And they have physical education, and we don't have that anymore. And so at the grassroots level, we need to do a fundamental change way in our educational system and drive for that, developing media and all books and so forth on the issue and getting that word out and spreading it across the nation. That's my thought.
Great thoughts. You know, one other thing we didn't talk about today is that the body positivity movement sometimes gets a lot of backlash. So sometimes when, you know, for example, like a clothing company will start marketing some of their sports or physical fitness clothing to people who are heavier, there's a backlash. People are saying, oh, you're trying to get them to think it's okay, you're selling them clothes. But really what you find if you talk to people is that when a physical fitness company makes clothes in their size, what that does is tells them that they belong in the gym as well. They can do sports and activity as well, and rather than being excluded from those things. So I think, yeah, definitely a lot of things that we could change for sure.
There's a big movement with that in the hiking world, trying to get outdoor gear that will fit people. And people usually use the hashtag, I think it's hashtag unlikely hiker or unlikely hikers. But that might help with the body positivity in the exercise type world.
I want to call on Sandra. She has her hand raised.
Thank you. So I want to talk a little bit about the schools because I don't know where the idea that there's no physical education is in school, because I've never been in a school that didn't have that. And second, for the lady in the story, the schools are giving away free food to every student, at least in my area in Ohio, because of the pandemic, and it's healthy food, and the parents can choose to pick it up or send it home with the child. And so all they really have to do is sign up and say, yes, I want the meals to come home. And they also get a free meal at the school. So I feel like that's a good way to help the kids. And I had a question in the chat about the lady. We have all of this in place for children. Isn't there a way that maybe insurance could cover a health plan for someone like her?
Yeah, great points. I wish there were more options, but those are great. I know a lot of the school foods aren't that healthy, but that's really great that they have healthy options where you are.
Yeah.
Yeah, our schools are doing the same things here, but depending on where you are from county to county, the food kind of varies wildly, and we definitely we're grateful that it's being done because it needs to be done. But you know, there's been a lot of backpedaling, I guess, legislatively regarding the policies around school food. So not very encouraging from that standpoint, but at least, you know, we're feeding kids, so that's good.
Okay, Laura also had her hand raised.
Yeah, on the topic of school meals, I just wanted to touch on that really quick. I'm in Charleston, and the free meals that are available here are like 90% carbohydrates, and a lot of the fruits and vegetables are really aging when you get them. But at the same time, it is awesome that kids are getting fed. I mean, kids need to be fed, but we stopped accepting those meals a while ago because it just wasn't good for our kids. But on another topic about like body positivity, it's interesting because you know, when you're overweight and you go to lose weight, you at the same time you're accepting where you are and you're trying to make a change, and there are people all around you who are still in that state and not ready to make a change. So it's hard to communicate, to be positive to them and be positive to yourself all at the same time. It's all a very confusing process.
Yeah, absolutely. You know, in our clinic, we always ask about people's support when they're going to lose weight, and who they live with and who they eat with. Even if you live alone, you might eat with other people routinely, and that plays a big role in how you're going to eat. And you have to figure out ways to manage that and navigate that as part of your plan, really, or else, you know, you're going to run into trouble.
A lot of times you'll find that there are people in your life that you really can't celebrate your wins with as you're losing weight, and it's a hard thing to accept at first, but you just have to know that that's the way it is, and you need to be completely supportive of them too, even though they're not in the same place that you are. And you don't need to tell everybody, hey, I lost 5 pounds last month or anything, because they can see it.
Mhm.
All right, Dr. Davidson, I think we are at the end of the hour. So I wanted to ask you if you could wrap it up for us in a couple sentences, what we talked about today. And then if you could throw out the name of that survey again. So if people wanted to take it after this walk, they could.
Okay, sure. Well, let me do that before I forget. So it's the Implicit Associations Test by Harvard. So you just Google Harvard, implicit associations, or implicit bias, or IAT, and it'll come right up. And yeah, to summarize what we talked about, I think, first of all, it's always important to remember that the causes of obesity are very complicated. Although on the surface it might seem simple, it's how much you eat, how much you exercise. When you look at what goes into those factors, it's huge. It's your biology, your hormones, your genetics, and your environment and what's available to you, and those social determinants of health. So I think when you think about how complicated the problem is, it really allows you to be a little bit more empathetic to others when you think about all the things that go into their struggles with their weight. So I think just also remember how many negative consequences can come from weight bias, you know, on health, at education, and in the healthcare field. And that will help you remember why it's so important to try to combat weight bias by whatever means you can, whether it's in yourself, whether it's in the media. There's positive media photos that are out there. So if you are doing a presentation and you're including people who have weight problems, you can always go to those websites as well. Again, I don't have the link, but if you Google weight bias photos, I'm sure they'll come up. I think the Rudd Center is one, and you'll get photos that have been approved to be used so that those photos won't kind of reinforce some of those negative stereotypes. So yeah, I think if we start increasing awareness of how complex the disease of obesity is and the negative consequences of bias, then we can really start to change those things in ourselves and in others. So thank you for your time today.
Thank you so much, Dr. Davisson. I think this is a really great conversation. We filled up the whole hour, so that was awesome. For those of us who are joining us on the walk today, if you wouldn't mind opening up the chat right now, typing who you are and where you're walking from. We want to see how far this program reaches. I know that I admitted some people to the waiting room towards the end of the hour. So if you missed the first part of the hour and want to hear more about it, we should be able to post this walk onto our YouTube channel either later this week or next week, so you can listen to it while you take another walk. So thanks so much, everyone, for joining us today. We love to see your faces. We're loving that the weather is getting warmer. So we will see you again in 2 weeks, same time, same place, here on Zoom. And thanks again, Dr. Davisson, for leading the conversation today.